my name is Taylor. I'm a PA student, and I'm going to show you about a peak flow meter. So this is a peak flow meter. It's used to monitor different conditions like asthma. And so what you do is you breathe into it. I will show you. You ideally want to breathe into it 3 times and get the highest level, but the idea is to breathe in it daily so that way you know what your average is when you're feeling healthy and normal, so that way when you're having symptoms of shortness of breath or tired, you can breathe into it and see how different you are from your average, so that way we can better help adapt your management plan and treat you. So I'm going to show you how to use it. So it looks like this, and you see that there is a scale on it. And you're going to do it twice, so you want to put your mouth around it, kind of like a whistle. You want to make sure it's sealed. And you're going to take a deep breath in and then quickly blow out as hard as you can. And you just need to do it that one time, and this thing will shoot based off how you're exhaling. So you want to start here. You take a deep breath in. And then you see, so my average is around 40. That's my baseline when I'm healthy. So if I'm not feeling good, I would take this and I would do the exact same thing, and I would see if it's where I normally am or if it's less.